Today we'll talk about something very important for your health: colorectal cancer, a disease that is affecting more and more people. This type of cancer is one of the most common and also one of the deadliest. Around 10% of cancer deaths are caused by colorectal cancer, which is why it's crucial to recognize the symptoms and warning signs. In this video, I'll share the 7 key signs you should watch for to identify potential problems in your intestines. Additionally, we'll talk about how to prevent it. Yes, it's possible to reduce the risk. I'll tell you what habits you should adopt and what foods you should include in your diet to protect yourself from this disease. But we'll also address an important topic: why are more and more young people under 50 being diagnosed with colon cancer? Before we start, let us know in the comments how old you are and from which city you're watching. Your participation is important, and it helps us create more useful content for you. Don't forget to like and subscribe to get more health and wellness tips that can make a big difference in your life and the lives of your loved ones. Let's get started. The 7 warning signs of colorectal cancer. Changes in bowel habits. One of the first symptoms of colorectal cancer can be a change in bowel habits. If you notice a change in the frequency of your bowel movements, such as going to the bathroom more or less often than usual, or if you experience persistent diarrhea or constipation, it's important to pay attention. Additionally, changes in the consistency of your stool, which may become thinner or thicker than usual, are signs that should not be ignored. Sometimes, cancer can affect bowel function, and changes in stool color, such as very dark stools, can also be indicative of internal bleeding. If these symptoms persist for more than a few days, it's best to consult a doctor for a proper diagnosis. Blood in the stool. The presence of blood in the stool is one of the most alarming signs and should be evaluated immediately. Blood may appear in several forms: red, if it's fresh, or black, melena, if it has broken down in the intestinal tract. Although blood in the stool can also result from less severe conditions, such as hemorrhoids or anal fissures, the possibility of colorectal cancer should not be ruled out. The blood could come from a tumor that is bleeding slowly or from an ulcer created by the cancer. For this reason, any episode of blood in the stool should be evaluated by a doctor to determine its origin. Persistent abdominal pain. Recurrent or constant abdominal pain is a key warning sign. This pain can range from mild discomfort to severe cramping and is often accompanied by a feeling of discomfort or pain when passing stool. Colorectal cancer can cause partial or complete blockages in the intestines, leading to pain due to inflammation and irritation of the tissues. Moreover, if the pain occurs along with other symptoms, such as diarrhea or constipation, it further suggests the need to investigate the underlying cause. Unexplained fatigue. Excessive fatigue that doesn't improve with rest is another symptom that could be associated with colorectal cancer. In many cases, this extreme exhaustion is linked to anemia, a condition where there aren't enough red blood cells in the blood. Anemia can develop when a tumor in the colon or rectum causes small blood losses that are not always evident. As this blood loss continues, the body is affected by a lack of iron and oxygen, leading to extreme tiredness. If you experience persistent fatigue with no apparent cause, it's important to seek medical attention. Abdominal bloating. Constant or recurrent abdominal bloating or distension can be a sign that something isn't functioning properly in your digestive system. Colorectal cancer can cause a partial blockage in the colon, preventing food and stool from moving properly through the intestinal tract. As a result, gases, liquids, and food residue accumulate, causing an uncomfortable feeling of fullness or bloating. If this sensation doesn't go away over time and is accompanied by other symptoms, such as abdominal pain or changes in bowel movements, it's important to consult a doctor. Unexplained weight loss. Unexplained weight loss is another symptom that may be related to colorectal cancer. If you experience significant weight loss without making changes to your diet or physical activity, it could be a sign that your body isn't absorbing nutrients efficiently due to a blockage or dysfunction in the intestines caused by a tumor. This weight loss may indicate that cancer is interfering with your intestines' ability to process food and absorb the nutrients your body needs. If this symptom occurs without an apparent cause, it should be evaluated by a healthcare professional. Incomplete evacuation sensation. Tenesmus. Tenesmus is the persistent feeling that you haven't fully emptied your bowels, even after going to the bathroom. This sensation can be extremely uncomfortable and is often associated with the presence of a tumor in the colon or rectum. Cancer can cause a partial blockage in the intestines, leading to a sensation of fullness or discomfort, as if stool can't be fully expelled. Tenesmus is more common in advanced stages of colorectal cancer and should be a reason for medical consultation if experienced frequently, so the necessary tests can be done. Now, we'll show you the 7 tips to prevent colorectal cancer. Maintain a high-fiber diet. A diet rich in fiber is essential for digestive health and reducing the risk of colorectal cancer. Fiber, found abundantly in fruits, vegetables, whole grains, legumes, and nuts, plays a crucial role in regulating bowel movements. It also helps maintain a balanced intestinal microbiota, which is essential for disease prevention. By promoting faster and more efficient digestion, fiber also decreases the time that toxins and carcinogens come into contact with the intestinal wall, reducing the risk of cell damage. It is recommended to consume at least 25 to 30 grams of fiber per day to reap its protective benefits. Limit the consumption of red and processed meats. High consumption of red meats, such as beef, pork, and lamb, along with processed meats like salami, bacon, and sausages, has been linked to an increased risk of colorectal cancer. This is due to compounds like heterocyclic amines and nitrites, which are produced when these meats are cooked at high temperatures or processed. These substances can damage the DNA of intestinal cells, contributing to tumor development. To reduce the risk, try to limit the consumption of these foods and opt for healthier protein sources, such as chicken, fish, legumes, and tofu. Drink enough water. Staying well hydrated is crucial for intestinal health and disease prevention. Water facilitates bowel movement and helps prevent constipation, a problem that, if it becomes chronic, can contribute to the development of digestive issues and colorectal cancer. Proper hydration ensures that stools are soft and easy to pass, reducing pressure on the colon. It also aids in toxin elimination through urine. It is recommended to drink at least 8 glasses of water per day, and more if you exercise or live in a warm climate. Exercise regularly. Physical activity is not only good for general health, but it also plays a key role in preventing colorectal cancer. Regular exercise improves intestinal motility, reducing the time during which potentially harmful substances come into contact with the walls of the colon. Additionally, exercise helps control weight, which is important because overweight and obesity are closely linked to an increased risk of developing colorectal cancer. Try to incorporate at least 150 minutes of moderate exercise, such as walking, swimming, or cycling, per week, or 75 minutes of intense exercise. Avoid alcohol and tobacco. Excessive alcohol consumption and smoking are 2 of the most well-known risk factors for many types of cancer, including colorectal cancer. Alcohol can irritate the intestinal lining, increase estrogen levels, which may also influence cancer development, and affect the body's ability to process essential nutrients. On the other hand, tobacco contains carcinogens that can damage colon cells and promote tumor development. Limiting or eliminating these habits not only improves intestinal health, but also significantly reduces the risk of colorectal cancer and other serious diseases. Maintain a healthy weight. Being overweight is linked to a higher likelihood of developing colorectal cancer due to factors such as chronic inflammation and increased hormones that may stimulate tumor growth. Abdominal fat, in particular, has been associated with a higher risk. To maintain a healthy weight, it's important to adopt a comprehensive approach that combines a balanced diet with regular exercise. In addition to reducing the risk of colorectal cancer, maintaining a healthy weight improves overall health and reduces the risk of diseases like type 2 diabetes, cardiovascular diseases, and more. Get regular checkups. Early detection is crucial for preventing colorectal cancer or treating it in its early stages. If you are over 45 years old, have a family history of colorectal cancer, or have certain risk factors, make sure to get the recommended screening tests, such as a colonoscopy. A colonoscopy is a procedure that allows doctors to examine the colon for early polyps that could turn into cancer if not removed. Early detection of polyps is key, as removing them can prevent them from developing into colorectal cancer. Don't neglect medical recommendations for preventive exams, especially if you have a family history of this disease or genetic factors that increase the risk. Colorectal cancer prevention doesn't depend on just one factor, but rather a combination of healthy habits. Adopting these practices can not only reduce the risk of this disease, but also improve your overall health and well-being. Remember that if you are in a high-risk group, don't wait for symptoms to appear before getting tested. Early detection is essential because it can make the difference between successful treatment and advanced disease. Finally, don't forget that the colonoscopy is an important test that can save your life. It's an effective way to detect polyps before they turn into cancer. If you're over 45 or have a family history, it's crucial to get this test. So, take care of your intestinal health and keep your lifestyle habits in check. If this content has been useful to you, share it with your friends and family. And, of course, don't forget to like and subscribe to the channel to keep receiving valuable information that can transform your daily life. See you in the next video.